Mr. Chairman, the floor is yours.
Okay, thank you very much. We'll try to move quickly on this. We think it's a very important bill. We got some good folks here to testify. Tobacco use remains the leading cause of preventable death in the United States, killing more than 480,000 Americans each year, according to an article by the U.S. Department of Health and Human Services, and indicating causes of cancer, heart disease, and respiratory disease. This has brought statistics as high as $170 billion in healthcare expenditures. Raising the sale of the age for tobacco and other smoking products will help reduce smoking. It'll save lives and save much money for healthcare. As of April 2nd, 2019, not too long ago, 9 states had raised the age of 21, and a number of cities have done it the same. It's a simple but tremendously important concept: reducing deaths, making better health, saving money, making life better for many. It's not complicated. It's the right thing to do. You've seen other states adding it now, and you've seen Washington looking to make it something nationally as possible. So at that rate, we'd like these gentlemen to speak that are alongside. So,
okay. Thank you very much, Representative Hoffman. My name is Jim Pittman. I serve as Executive Director of Orleans Parish Medical Center. I also serve as a spokesperson and advocate for Louisiana's Smoking Cessation Trust, and I serve on the board of Louisiana Special Olympics. With me today is Dr. Juan Gershanek, and Dr. Gershanek is the President-elect of Orleans Parish Medical Society. He serves as Chair of Pediatrics at West Jefferson Medical Center, where he also serves as Medical Director for the Neonatal Intensive Care Unit. And we're here today to speak on behalf of this important bill, House Bill 38. And we're here on behalf of parents, students, educators, physicians, and healthcare leaders throughout the state of Louisiana who are urging lawmakers like yourselves to fight nicotine addiction, especially with our youth, by supporting Tobacco 21 legislation, House Bill 38. According to the Campaign for Tobacco-Free Kids, 95% of adult smokers begin their nicotine addiction prior to age 21. The ages of 18 to 21 are a critical period when many move from experimental smoking to regular daily use. Louisiana's 22.8% adult smoking rate remains one of the highest in the country, contributing to 7,200 deaths, $1.89 billion in healthcare costs, $2.49 billion in lost productivity every year in Louisiana. Louisiana's under 18, 12.3% are smokers. That's under the age of 18, and compared to the U.S. average of 8.1%. The U.S. average for smoking for adults is 14% compared to our 22.8%. Here's some more information regarding nicotine addiction and the concern related to e-cigarettes. On January 2nd, 2019, CNN report ranked nicotine the third most addictive substance in the world, behind only heroin and cocaine. One Juul pod contains the nicotine equivalent of an entire pack of cigarettes. New research shows that many teenagers don't understand the amount of nicotine they're inhaling with every puff. The survey published on April 22nd this month in the journal Pediatrics discovered that participating youth were unaware of the nicotine content in their vaping devices. Respiratory expert and board-certified internal medicine specialist and pulmonologist Dr. Len Horowitz said the risk for addiction is clear. It's well known that e-cigarettes end up delivering more nicotine because every draw yields nicotine, whereas traditional cigarettes burn down between puffs and therefore deliver less. In December 2018, the U.S. Surgeon General, Dr. Jerome Adams, issued an advisory about the negative health consequences of teen e-cigarette use. In addition, the FDA is now investigating dozens of seizures linked to e-cigarettes. Additional research published by Chemical Research and Toxicology, also this month, reported that high nicotine concentrations in Juul e-cigarettes were toxic to living cells. Another article in this month's Psychology Today reported that nicotine severely halts and lessens the development in teenagers' brains, particularly with the prefrontal cortex. The prefrontal cortex is responsible for emotional regulation, decision-making, and complex cognitive behavior. An underdeveloped prefrontal cortex can impact the remainder of his or her life. According to the, a couple more for you before I hand it over to Dr. Schatz, who's going to tell you some real-life cases. According to the federal court-ordered corrective statements published by major tobacco companies intentionally designed cigarettes to create and sustain addiction. This is their own words. Also, the tobacco company's own words, when you smoke, the nicotine actually changes the brain. That's why quitting is so hard. Altria, the manufacturer of Marlboro, now owns 35% stake in Juul Labs. E-cigarette companies like Juul continue to be investigated by the FDA for questionable marketing practices that directly target teenagers. Over the past year, youth e-cigarettes has increased by 78%. An increasing number of states throughout the United States have had enough. As of April 18, 2019, 13 states, Arkansas, Delaware, California, Illinois, New Jersey, Massachusetts, Oregon, Hawaii, Maine, New York, Utah, Washington State, and Virginia have all raised the tobacco sale age to 21. On April 9, 2019, the Texas Senate voted in favor of Tobacco 21 legislation. They're awaiting their governor's approval. Connecticut, Florida, Maryland, Arizona, Vermont, and Ohio are not far behind in their push to fight teen nicotine addiction. So look no further than Louisiana's 22.8% adult smoking rate, while the U.S. average is 14%, and the influence on big tobacco on our children for the primary reasons why the 2018 America's Health Rankings ranks Louisiana 50th, dead last in the U.S. in overall population health. With that, I'm going to hand over the mic to Dr. Juan Gershanek so he can talk about nicotine addiction and cigarette smoking from his perspective in seeing patients and newborns. Dr. Gershanek.
Thank you, Jim, and I really appreciate you people's efforts in trying to get us in better health in the state. And as a pediatrician, I like to represent, in good part, people that cannot speak by themselves, as well as the youth, as Jim mentioned. We are having a significant problem with the use of e-cigarettes in young adults that don't understand the scope of what they are trying to do. I would like to have a little extra time to tell you about my experience as a neonatologist. As a neonatologist, I am a pediatrician that takes care mainly of critically ill babies. And we also get consulted on the part before the baby is born, and I know many of you got that very close to heart. There are plenty of side effects for the fetus if the mother smokes. The babies not only have the greater chance to be born prematurely, which by itself can really trouble their life for their duration, but also have birth defects sometimes, cleft lips, cleft palate, some other difficulties, including the fact that the mothers may be less fertile and can have a cause for abortions or stillbirth. The babies that are born after a mother smokes cigarette are usually much smaller in weight, in the average, than the normal, regular babies. And in the last few years, we have become acquainted that also these babies of mothers that smoke can have the withdrawal syndrome, just like some of the other illicit drugs can do it. And we are seeing babies that have all the symptoms that babies with withdrawal have, mainly shivering, and all the point to gastrointestinal difficulties, diarrhea, all of that secondary to the use of tobacco in the mother. It's with a great deal of from the medical profession that we need to try to address things that can be prevented more than cured. And I think you can help us greatly if we can introduce measures that will prevent young people from start using these tobacco products. And I thank you for your attention.
Thank you.
Mr. Vice Chair, we have some other people to come to the table. I do have a very important amendments that I'd like to ask you to consider at this point as they come forward.
So staff, Chairman have an amendment. Please read the amendment into the record.
Thank you, sir.
Ty?
Thank you, Mr. Vice Chair. Members, this is a set of 13 amendments bearing number 1360. They have been posted and distributed in advance. Amendment numbers 1, 4, and 5 are title amendments. Amendments number 2, 3, and 6 eliminate the words purchase or possession. Amendment number 7 removes the requirement that a manufacturer, distributor, or retailer have actual knowledge that they are selling or distributing a tobacco product to a person under the age of 21. Amendment number 8 on page 2, line 7 deletes the words purchase and inserts sale. Amendment number 9 adds to the wording for signage required by present law. Amendment number 10 makes it unlawful for tobacco products to be sold to a person under the age of 21. Amendment numbers 11 and 12 deletes lines 26 and 27 on page 2 in their entirety, and lines 1 through 5 on page 3 in their entirety, respectively, and repeals the law that makes it unlawful for a person under the age of 18 to possess a tobacco product. Amendment number 13 amends and reenacts revised statute 26:793C1, sections 910, section 910.1A, section 911A1, and section 917. Section 793C1 adds to the powers of the Commissioner of Alcohol and Tobacco Control by requiring unannounced follow-up compliance checks within 3 months of any violation, and mandates that the results of such checks be publicly available. 793 also raises the minimum age from 18 to 21 of persons who shall be enlisted by employees of the Office of Alcohol and Tobacco Control to test compliance. Section 910 raises the minimum age from 18 to 21 for anyone purchasing tobacco products or alternative nicotine products from vending machines. Section 910.1 raises the minimum age from 18 to 21 for anyone purchasing tobacco products or alternative nicotine products from self-service displays. Section 911 raises the minimum age from 18 to 21 and also requires retailers to check the identification of anyone attempting to purchase tobacco products or alternative nicotine products who appears to be under the age of 30. Section 917 raises the minimum age from 18 to 21 and eliminates paragraphs 1 through 3 and subsections B and C. Revised statute 47:851C2 updates the wording on signage required to be posted on vending machines to reflect the minimum age change from 18 to 21. This concludes the amendments. Thank you.
Jack?
Chairman, on your amendments.
Yes, sir. I know that took a while. I apologize. The amendments strengthened the bill tremendously, and that was with help from several people and organizations to make the bill stronger. We made sure that every bill that's in place includes smoking and age, moving the age from 18 to 21, including bills that may not even be completed yet. I have one that addresses fees to sell, and another is Kirk Talbot's bill that increases the penalties. So when those bills say 18, it would move to 21 as those bills move forward. We have made the law stronger concerning the sale of tobacco illegally rather than the purchase. It's the seller's responsibility to make sure the purchaser is 21 years old. We also strengthened the language about the signs being 21 years age to be conspicuous and within 6 feet of each register, so it'll be obvious how old you are when you're there. In line 24, we changed the wording from the purchaser buying to the purchaser being sold. We also changed the language in the abstract to read raise the age for distribution instead of purchase or possession. And we've already mentioned that, and that just concludes with the abstract. The other amendments simply make sure that every bill in place, and there were several in Louisiana that have age 18 listed somewhere, it changes it to 21. And the last amendment simply makes sure that LDH is in control of making sure that compliance checks that are already in place are conducted at least every year. And if non-compliant retailers have been found, then a follow-up visit is required within 3 months. So basically, this bill is about raising the age to 21 and making sure we have places to get it accomplished. I'm glad to answer any questions, and we have some important people to visit with you. But I guess maybe you want to look at just...
I don't see any questions on the amendments. Any objections to the amendments? Without objections, the amendments are approved.
Good afternoon, Mr. Chairman and members of the committee. My name is Shannon Quimby, and I'm the Eastern Director for the Preventing Tobacco Addiction Foundation and tobacco21.org. We work nationwide to raise the minimum legal sales age for all tobacco and nicotine products from 18 to 21 to prevent youth use, youth initiation, youth addiction. Our work in this policy spans more than 2 decades. And through research and experience, we know that for a Tobacco 21 law to work, to be effective, it must start with a strong bill. Many of the amendments you adopted just now, we worked with Representative Hoffman to create those to help his bill become stronger and one that will work to protect the youth of Louisiana. The momentum, as mentioned by the physician before me, the momentum for Tobacco 21 has increased dramatically in the past couple years. In December of 2017, there were 5 states and about 270 localities with Tobacco 21 policies. Not even 18 months later, as of today, 14 states and more than 470 cities are covered by the policy. The pace of the policy is a direct response to the rapidly changing tobacco landscape. We are in the early stages, and I mean early stages, of a new addiction crisis, our youth vaping epidemic. After decades of progress in reversing youth use and youth smoking, Juul and other makers of e-cigarettes have re-glamorized teen smoking and addicted millions of American kids to nicotine. And nicotine addiction, as you heard from the professionals, is no small thing. It is the most powerful and pernicious addiction that one could face. Research also shows, and this is frightening, that those who initiate on e-cigarettes are at least 6 and probably more times more likely to migrate to combustible tobacco later on, and some end up using both. So what that means is that your youth smoking rates in Louisiana, which are already unacceptably high, will go higher from the kids who are vaping, who will later migrate to tobacco cigarettes. These rates are likely to go up unless something is done to address the vaping problem. Because of Juul, the tobacco industry has found itself in the midst of a PR crisis. So Altria and others say that they're supporting Tobacco 21. But the truth is they are supporting the weaker policies in Tobacco 21 that we're seeing across the country. Policies that include or strengthen preemption, not allowing local governments to pass policies that are specific to the needs of their communities. As public health advocates, we strongly advocate for the repeal of preemption where preemption exists, as in Louisiana, because one size tobacco control does not fit all communities. Beyond this, I wanted to talk just briefly about enforcement. For a Tobacco 21 law to be effective, It must contain several critical components, many of which are in the amendments that were read to you this afternoon. Penalties for selling to those under 21 must be on the retailer, not on the youth, not on the clerk at the counter. Those are known as PUP provisions, and they have a long history here in this state and many others. But purchase, use, and possession, PUP laws, don't work. They just don't work to reduce youth use of these products. They are outdated, they are ineffective, and they fail to hold the retailer accountable for selling to kids. Another amendment you heard today was about mandated compliance checks. Retailers must be told that they are going to be watched, they are going to be checked. And if they are found in violation of the law, they're going to be rechecked. Other components of a strong Tobacco 21 bill include tobacco license permits, which you already require in the state, which we would advocate you raise the fees for these tobacco permit licenses, which doing so would help fund your enforcement. Just raising the fees alone would help fund enforcement. And finally, we advocate for stiff fines for violators with a clear suspension and revocation threat and follow through. This encourages compliance of the law, especially for those retailers who continuously flout the law. So I urge this committee to consider all these amendments to pass a strong Tobacco 21 bill for the state of Louisiana, to discuss the repeal of preemption in the context of tobacco control, and to work to increase fees and fines. And doing so will help protect the kids of Louisiana. I thank you all very much for this opportunity this afternoon. Thank you.
I don't see any questions for her, but I have a few questions. You work for Altria?
No, sir. I work for the Preventing Tobacco Addiction Foundation.
Okay, so you mentioned the preemption. You mentioned one size doesn't fit all. Mm-hmm. So I'm not an attorney. I need you to kind of explain to me about the preemption. I'm under the impression that the preemption is something that allows the locals to make their own rules on smoking tobacco.
Preemption is not in our bill, though.
So we are not gonna stop the locals from being able to add more stricter rules if they would like?
Well, current statute in Louisiana does not allow for local communities, does not clearly allow for local communities to pass tobacco control policies that are stronger than those in the state.
So when the locals recently were doing the smoke-free in public places, that wasn't legal?
Well, I did just hear about that, as a matter of fact, of that law in Baton Rouge here. Is that correct?
I think Baton, several places, yes, ma'am.
So, you know, I don't know if that having passed will receive legal challenges. It may. We do advocate for preemption where it exists to be repealed. I know it is not in this bill. I was just simply listing the many things that health partners and health advocates do push in a tobacco.
So you advocate for locals to be able to add rules if needed?
Yes, we think it's important because not every community in any state, in the state of Louisiana or any state, has the same needs around tobacco. Some, I guess there are regions here. Some regions, some counties have higher smoking rates. Some have higher non-compliance rates of retailers. So with that being fact, it is important for a community to be able to identify and address and pass laws that are specific to their needs. It is.
Last question, and we'll move on. You mentioned retail penalties. What are the penalties in this bill? It's probably a Chairman Hoffman question.
Actually, penalties are already in law for at age 18, and there are two bills that are going to before other committees that would actually address changes. Talbot has one of them. I have the other. Mine has to do with the fee increase. His has to do with the fines. Those still have to be passed separately.
So this bill doesn't, if it passed in its current form, what is the law?
Well,
what would be the law?
The current fees and fines would stay in place if the others don't pass. This would just take what's already in place.
The current is, and you might not have the specific answer, but what is the fee or the charge that's going to be placed on an 18-year-old if they buy tobacco?
The fines. The present law provides that whoever violates present law by selling or buying tobacco, alternative nicotine products, or vapor products should be subject to the first violation is a fine up to $50, second violation fine up to $100, third violation up to $250, subsequent violations fine up to $400. And then, well, that's not this bill, but this bill would still have the fines that are in place now,
which are equal.
18-year-old.
Which is if someone sells and someone purchases, they both get. I think your first fine you said up to $50.
I think there's still different fines.
Okay.
Well,
we'll get to it later. We can move on.
Okay.
I'm sorry. Thank you.
Okay.
I'm Dr. Jay Brooks from the Ochsner Health System, and I'm a practicing oncologist in the state for more than 30 years. I returned here 30 years ago from the National Cancer Institute. Actually, Dr. Krashanik gave me our first job when I was a medical student at LSU in Shreveport. It's kind of nice to see him back. We function sort of at both ends of life. I see mainly cancer patients. This morning I saw 15 patients between the hospital and the office before I came here, and 5 of those 15 patients had direct related diseases to tobacco. So I told them I was coming here today and asked them, when did they start smoking? All of them started smoking before 21, usually between 18 or 19. A lot of them started when they were in college. And they all regret it. I mean, they're all, suffering from the ravages of tobacco. There have been excellent, information given to you this morning. It's amazing how far we've come over the 30 years that I've, practiced medicine here in Baton Rouge. You have to realize 30 years ago, you could smoke in the hospital rooms of this city. I mean, think about that for a second. That's pretty stunning. The state was very far advanced in 2007 when it's passed the tobacco, cessation in restaurants and restaurants. You recently participated in trying to stop tobacco in bars and casinos, and we've been successful, around the state in various aspects of that. But getting to the source of where people start smoking is the key. The tobacco companies understand that the patients that I see, a large part of them will die as a direct result of their tobacco addiction. My father died of that at age 51. And I think it's important that they look upon the youth as replacement product. And that's why the tobacco delivery devices, the smokeless tobacco, is so important to them, because they're trying to addict a new generation. It's an addicting, a very addicting drug. It's one that we can prevent. We're never going to be perfect, but we can certainly add to the difficulty of getting started in tobacco and save people's lives, so we're not number 50 in the country like we are today, that we can improve the health of our population, and that's what we're here to do.
Thank you, sir.
I have one question, Representative Turner.
Hey, thank y'all for coming today. I'm all about healthier Louisiana. Actually, I'm in the medical field, so I'm all about that. And I have 2 questions about the fines. When we're going to start writing fines for people 18 to 21, and they're at their 4th fine, they get caught the 4th time for smoking, and it's $400. What are we going to do to help the addiction part of this? Because that's where I'm running into an issue on this bill.
Are you talking about
once you write an 18, 19-year-old a $400 ticket for smoking the 4th time they get caught smoking, first of all, financially that's devastating. So they're going to be going through the court process. Second of all, that's not the problem. The problem is they're addicted. So what are we doing to help with that? How are we solving that and not creating more of a legal issue? That's my question.
I know in our health system we have an entire program that for tobacco cessation. I sent 2 patients to it this morning, and a lot of patients will go through it multiple times. But that's something that I think would be very valuable that we try to set up for people who are addicted. They are addicted to a drug, and it's really important that we try to help them to get off of this. We're not going to, and it's something that's going to happen over and over again.
If I may.
The fines. The fines that I read were increased fines from the other bill. They're not as high right now. But again, that's only one part of this thing. The fact we're making it 21 is going to go a long way in helping them not to ever smoke at all.
And Representative Turner, we are not, in this bill, we're removing penalties for purchase, use, or possession, precisely because those 18 to 20 who can no longer be sold nicotine products and who are addicted should not be penalized, should not be pulled over and have the added burden of being able to be cited for using tobacco. Okay. They are addicted. So we want to hold the retailer responsible and only fine or penalize the retailer for improper sales.
Okay.
That's a different bill.
Okay.
2 different bills.
I think what you were referring to stopped if you were born after 1976.
I think it's 83.
Is 83? So that still is the 18-year-old involved in that? No. So that's passed. That was my issues with this bill, with those 2 items.
And then, like I said, they're not part of this bill. This is just moving to 21.
You finished, Mr. Turner? Okay. I have questions. Representative Pope.
Thank you, Mr. Vice Chair. I think it's been said a couple of times, but sometimes we tend to understand what we want to understand and don't hear what we want to hear. And I'd like to have this repeated. This bill only pertains to raising the age from 18 to 21. Is that correct?
Yes, sir, for the most part. Now, the amendment I did a while ago...
Well, that's just where I'm going with the amendment.
Okay.
Go ahead and explain that to me.
Well, it just changed the way... It still doesn't change the fines or anything like that.
That's my question.
It does not.
Does it have anything to do with penalties?
There's another bill that may pass.
But it has nothing to do with this bill. It has
nothing to do with this bill. Yes, sir. Nothing to do with this bill.
Okay. That answers it pretty much for me. I'm talking about the fines, fees, penalties, all that. Probably going to be addressed somewhere else, but that's another day for another
day, another dollar.
$1. Okay. Thank you, Mr.
A lot of dollars, actually, in some of those.
So, but thank you.
There's no more questions, Mr. Chairman. You had anyone else you wanted to speak?
I'm not sure who else. If you had any other cards, I'm not even sure who else.
We have plenty of cards.
Okay.
Oh, we have a question, Representative Bagley.
And I apologize, Chairman,
yes, sir,
for getting late, but my son was here and I need to talk to him.
I understand.
Yeah, you know my objection, and I don't even know, maybe someone's brought this up. I object to lowering the rate or raising the rate higher than 18 because of I believe that if a person at 18 years old is able to die for this country, to vote, to decide the direction of this country, that we shouldn't restrict them even though we do already have laws in that way. And I'm certainly not in favor of adding any more laws. Now, I don't know if we talked about an amendment, I don't know if that was done, about military.
Right. I did not do a military amendment, though I would not object to a military amendment.
Well,
if you brought a military amendment, I would be in support of it, but I didn't include it. And I'm told that the military, though they do, can smoke, that the military leaders prefer them not to smoke because they've seen how bad it is for you.
Well, and I'm not a smoker, nor am I a proponent of that. But someone else's right to smoke, I do stand for that, just like I stand for your right to vote, that sort of thing. I think policing a military exemption would be a disaster. Are you old enough to smoke, son? Yeah. but I'm in the military, so I'm not but 19. So it's like, well, sell me your car. Well, I don't have it. I left it at home, and I went to Korea, whatever. Well, how do you police that? How do you prove all that? I just think that would get into a whole nother realm. Again, I'm not sure that, and I do know, I have read that the federal government is considering this. I know Walgreens has already done it.
Right.
Not to say that that's a bad thing. That's what's going to happen, and I'm going to support those laws. I can't vote for this here, and I do appreciate you bringing it because I do understand where your heart is, and mine's the same place. I just look at it a little differently. Thank you. Thank you, Mr. Chairman.
Thank you, Representative Bagley. Representative Cox.
Well, the chairman and I have talked about this, and I think what he's doing is noble, and I wish nobody smoked. I think Johnson talked. Well, you told me you wish you could make the age 80 or 92 or something like that, and that would end it. But having said that, I think the vape is in here too, and what I wanted to ask the question was, how does because when somebody's hooked on this stuff, I heard the doctor speak of, how did you say it? Well, you gave all these statistics about how guys and how now they're on nicotine, but I didn't hear you talk anything about that when they're on vape, they go from, some people say 700 chemicals or 280 chemicals down to 1. Because there's arsenic, there's tar, and of course you got nicotine, which is the substitute. So I have a problem with the fact that the vape stuff were, and I told, this is nothing I didn't tell the chairman about, is that I had never seen them. I thought it was weird, them guys walking around, and I see this big puff of smoke. And until I saw my brother-in-law who had it, and he's not smoking anymore, but he's changed from either 700 chemicals, and y'all know what it is, I don't, and now he's down to 1, and his colors come back, and that stuff. So, and I'm wondering, am I limiting somebody who is now, who's addicted? Because he compares cigarettes to crack, that's what he said. I mean, that's exactly what he compared it to. He said, this is a horrible product. He said, it's one of the worst things I ever done in my life. He said, but brother-in-law, I can't quit. And he started vaping the other day, about 4 months ago, and he hadn't smoked again, and his colors come back. I wonder, are we limiting those people with the opportunity to possibly go from arsenic to just a little nicotine? So that's one of the things, and I did, and I, Bagley and I are not on all agreements, but at 18 years old, I seen people die, and I can't limit it. And I told him,
I will not object to amendment that.
But I told you, I know you did, and I appreciate you offering me that. But what this does, the military is adamantly against smoking. Matter of fact, now when you get ready to smoke, you got to find a place to smoke. Much like we've done with our laws, is you got to stay so far away from the building, because it used to be if you got them, you drop out and smoke them. And I didn't smoke, and I had to stand in formation or still continue to work. So it created the opposite effect. So now, but they're not gonna. It would also make it look like that you were supporting the recruiting for the military, which wouldn't be bad. But on the other hand, it would make it look like that the military is supporting smoking if we did a carve out, and that would probably be what it would be. We talked about that.
Yeah,
and I don't think it would justify it.
Again, you could make arguments both ways, but I didn't carve it out.
I know you did. I know you did. You talked to me.
And military also cannot drink until they're 21.
Yeah, and that was another thing we talked about. They didn't do a carve out for drinking either. Right. But if I was choosing drinking too, I would say
how can somebody who will put their lives on the line not be able to drink? And on the military installation, you can buy, I told you, you can buy liquor cheaper than anywhere else in the world. So I'm not saying that they support that, but that you sure can buy it. I'm not against it because I'm like him. See, the chairman he doesn't just have a heart for this, but he's actually been through this.
That's true. I'm an ex-smoker. I started when I was a senior in high school. We thought it was good for you.
Yeah, well, it was cool. It was cool, right?
But I found it was cool, and I liked it. I'll never forget the day I quit, which was several years later. I was driving down the street, and I littered the street. I threw the cigarettes out. I would give anything. You could offer me a cigarette and $10,000 bill today and tell me if I smoke the cigarette, I can keep the $10,000 and hand them both back to you. I promise. Give me $20,000, I'll think about it. But not very long.
Not long.
And I quit in the 70s, and in fact, you may have heard me coughing today. I still have some issues with that. So,
and he is the voice.
Well.
Yeah. So, but anyway, having said that, I'm not against it. I have that one little carve out because I've seen young men die for this country, bleed out, and die, and so I won't restrict them from anything. But I love you like a brother, you know that, though. And
I love you too.
Yeah, so.
But it needs your support.
I know. That's the way he goes, man. Thank you, Mr. Vice Chairman.
Thank you, Representative Cox. Next for questions, we have Representative Robert Johnson.
Thank you, Mr. Vice Chair. And I guess my question is, if it's bad at 18 to 21, it would be bad after 21 too.
It is bad after 21, but I kind of kiddingly said let's make it 81. But
it'd be bad at 8. It might be worse.
It'd be probably a lot worse.
I don't know. That's when you really want oxygen. I would assume.
There's some reason you have ages for this. Now you can't smoke legally at 17 right now. You've got to be 18. So
right, but you're still in your parents' care.
The body is still developing. Yeah. Physically, it's developing between 18 and 21, and just makes. Remember, we did the alcohol the same way because you used to be able to drink alcohol at 18. It was a movement it's a movement just to make it better, and because many won't start smoking if they don't ever start. I see statistics over 20%. That means there's billions of dollars in health care that will ultimately be saved, literally billions of dollars, because it costs tremendous money. And any doctor you talk to will answer that question for you.
Well, but again, I guess it comes down to it, and again, I mean, when you get to be 30, you start losing muscle mass, and I mean, at that age, it would be bad to be smoking.
If you bring a bill to 30, I'll be your co-author.
I just think
seriously,
if we think it's so bad, and that's what I'm saying, maybe it all ought to be eliminated. But I mean, that becomes an issue.
That would be a big issue. That's not the same thing we're trying to do. But the body is developing between 18 and 21.
But like I'm saying, and again, using the military reference. Again, at 18, you can. I guess it's just a matter of choices. Right. I mean, obviously, the military is a dangerous choice too.
Yes.
I mean, it has sometimes very grave consequences, but you're making that choice. So I mean, it comes down to me to a matter of choice, and I guess that's where, I mean, I may not like everybody's choices, but to me, if you can make a choice at 18, that can affect your life. And joining the military is certainly one of those choices.
It is.
And certainly smoking, and I'm not a smoker, but if you make that choice to do it, to join the military, and society feels that you can make that choice at 18, and sometimes mamas and daddies don't like those choices when their kids make them, even though they might be proud, but there's still a serious choice. Certainly they probably don't like the choice when they make the choice to smoke either, but they might be old enough to make it because of what we allow them to do in terms of military service. So it gives me great pause. And I know if we did an amendment, from my legal experience, I know an amendment to exempt the military or exempt those in the military probably would not be constitutional. So I don't know how.
Well, I don't know about that. I wouldn't have.
I think we've tried it when we did it with alcohol.
But I wouldn't object to such a.
No, and I understand. I just don't think it would be constitutional. So I don't know.
I think it would be constitutional, but
I think it's
you're a lawyer and I'm not.
Yeah. But in any event, that's what I guess I don't understand the 18 to 21 if it's so bad. versus at 21.
Statistics show
I still
over
think it's bad.
20% will never smoke if they change to 21. That's the statistic I read nationally, and that would be literally billions of dollars in health care.
Okay. All right. Thank you, Mr. Chairman.
I see no more questions, Mr. Chairman. Do you want me to start calling the supporters and the green cards?
Yeah, sure. I'll get out of the way.
First one, I think he spoke already. Well, I'm sorry, we do have a question. Representative Moore?
I don't have a question, but I just wanted to make a statement.
Yes, ma'am.
Dr. Hoffman, there have been a lot of things that I've had to experience in my life, but I just want to let you all know that way back when my mother was born and so forth, I don't think they addressed smoking or not, but she started smoking at the age of 15, and she died at 53. So she didn't get a chance to see a lot of her grandkids and so forth. And not only did that impact the family, but also I never smoked, but I got secondhand. So it was a lot of problems. But again, at 15, I'm sure she would not have perhaps made that decision because she regretted it before she died.
Absolutely.
Yes.
Representative McMahan for question.
Oh, just a comment. You know, we're sitting here on health and welfare, and we need to look at what it's costing us as a state and what we're spending on it. And we also need to look at the hard facts of the addiction rate for chronic smokers between 18 and 21 when we do this. And I come here today not for sure where I was going to be, but after thinking it through, I think there's one way we need to go on this. And I have a problem with, you know, telling an 18-year-old that can go to Afghanistan and serve our country, but at the same time, I feel like we've got to follow the science, and we've got to look where we're rated as a state. So that'd be my thought.
Thank you, sir.
Thank you. We have Representative Stagnant for questions.
Thank you, Mr. Vice Chairman. You know, I remember as a younger man coming into the Senate Health and Welfare Committee and lobbying that committee on a bill at that time, and it was the late 80s and the early 90s. And to my shock, I'm a young chiropractor out of school, and I go to testify on the bill, and when I walked in the room, there was a layer of smoke across the entire room.
That was sad.
I can name all the senators, and all 5 of them were smoking at the time.
I think Haney was here.
And times change, and sometimes we have to make those changes because smoking has so many comorbidities and is costing our healthcare system and our public dollars billions upon billions of dollars. And sometimes the public policy has to override sometimes choice issues. And while I agree with all of my colleagues about serving our country, almost everybody who has started smoking earlier regrets it later in life and wish they wouldn't have done it. And I think they depend on people like us to help make those decisions. I think you got a good bill here, Mr. Chairman, and I'm going to support it.
The movement from 18 to 21 won't stop everyone, but it stops, like I said, at least better than 20%. That's the statistics show, and that makes a lot of difference. And then hopefully it'll end up higher than that.
You finished, Representative Stagnant?
Yes, thank you.
Okay, we'll go to supporters. As president would like to speak. Mr. Jim Pittman, I think he spoke already.
You did.
Yvonne Jershanik, he spoke already.
I think so.
Jay Brooks, would he like to speak? He means support, he waves. Jordan Keys with Louisiana AAP. Okay, you're next. So we'll let her go.
I apologize. This is my first time in the Senate, so I didn't know the decorum for sitting down. But I am a pediatric resident with Our Lady of the Lake, supporting this bill. And a lot of the people who have came before me have already told you statistics that I already had on my sheet of paper. But there were a few things that I found concerning as far as the sale of vaping. They sell fruit and candy flavors that are attractive to teenagers, which I think is concerning because that's going to make them want to use vaporizing products. I also had some statistics that teens who are currently smoking are 3 times more likely to use alcohol, 8 times more likely to use marijuana, and 22 times more likely to use cocaine and other risky behaviors simply just from smoking. And then last but not least, I've heard multiple people say that we can't tell an 18-year-old what to do, but another part of that is we have 18-year-olds who are buying these products for children who are 14 and 15 years old. So that's concerning because if we can, I guess, increase the age, that could reduce the amount of children that are ages 15 to 17 from smoking until a later time, till they are, I guess, more mature to make those type of decisions. And then last but not least, nicotine, as it's already been said before, can affect the adolescent brain, so it impairs their learning, their memory, and their attention, which could prevent them from reaching their greatest potential as an adult if we have these types of, I guess, products available to them. And that's all.
I don't see any questions. I'll read out the green cards. We have Randy Haney with Altria. He's present and in support, would not like to speak. Mary Beth Wilkerson with Louisiana State Medical Society is present, in support, would not like to speak. Catherine and Jim Harris is present with Ochsner and would not like to speak. Nick Waltz, Louisiana Primary Care Association, is present, in support, would not like to speak. T. Bradley, Tulane University Health Systems, present, in support, would not like to speak. Jennifer McMahan with Metropolitan Hospital Council of New Orleans is present, in support, would not like to speak. I'll just name all of them instead of keep saying it, right? Greg Waddell with the Louisiana Hospital Association. Ashley Politz with Louisiana AAP. Randa Womack. Stephen Wright with the Louisiana chapter of American Academy of Pediatricians. Linda Spradley, March of Dimes. Ann Steer, Executive Director, NASWLA. Maxine Cormier, Louisiana Hospital Association. Suzanne Nelson, Louisiana Partnership for Children and Families. Shrew Thompson with Christus Health. Linda Hawkins, League of Women Voters. Gabrielle Keys, Mary Bird Perkins Cancer Center. Cindy Bishop with Checkmate Strategies. Richard Bridges, Louisiana Academy of Family Physicians. Kathy Klebert with Louisiana Medical Association. Chris Adams, Louisiana Healthcare Connections. Maria Bowen, Louisiana State Medical Society, and Christian Rhodes. They were all in support. They're present but would not like to speak. Next, Mr. Chairman, we'll do the white cards. We have Lance Barber that would like to speak with American Cancer Society. And we have Tora Moore, Louisiana Campaign for Tobacco-Free Living. And Shauna Shields. They are present and will provide information. Ashley Hebert, if you would like to come. Claudia Rodas, Campaign for Tobacco-Free Kids. And Alex Billu with the Department of Health is also present if needed for information.
Vice Chairman, committee members. My name is Ashley Hebert. I'm Government Relations Director for the American Heart Association. The Heart Association advocates for policies at the local, state, and federal level to prohibit the sale of tobacco products to anyone under the age of 21. We do support this policy when it is comprehensive. These laws should include effective enforcement mechanisms. This bill does propose a change to that minimum sale age, but as it's written, it's largely a tobacco industry favoring bill. We feel that it does not fully protect the health and well-being of our youth yet. In its current form, it does not have adequate fines or fees. We understand the plan is to have that on another bill. Although passing Tobacco 21 laws have some effect on youth purchasing, there's a significantly more reduction in adolescent smoking rates when there is sufficient enforcement that disrupts the sale. That when it comes to our youth and public health, passing something that is short of comprehensive science-based Tobacco 21 policy has good intentions, but it is can lead to far-reaching negative consequences. I think we owe it to our residents, our health, and the future of Louisiana to make sure we are adding enforcement to this bill in some form. Thank you.
I didn't have testimony. I was just going to answer questions.
Okay. Good morning, Mr. Vice Chairman and members of the committee, or good afternoon. Sorry, I've been here all day. My name is Lance Barber. I'm the Government Relations Director for the American Cancer Society Cancer Action Network. We are the advocacy affiliate of the American Cancer Society. And before I get started, you know, we have several concerns with House Bill 38, but I will state for the record that the American Cancer Society Cancer Action Network does support the intent of the bill, which is to raise the age of smoking from 18 to 21. There are several components of the bill that we look at to determine if a policy would be considered to be adequate. And I'm gonna just go through the list of what we like to see the law cover. So we wanted to cover all tobacco products, including electronic cigarettes, provide public education and training and technical assistance to retailers, implements measures for active enforcement such as retailer licensing and penalties, including licensing suspension and revocation for those who do not follow the law, does not create a category of products which would exempt them from the tobacco control laws, does not penalize the youth, and does not preempt other jurisdictions from passing strong tobacco control policies. We have several concerns just within the bill, and Ashley touched on them, so I don't want to be redundant to you all. With the current bill, it does not improve the enforcement, and it keeps the fines and the fees at current levels. While I understand that there are other instruments at play out there in the legislature, our concern is, you know, there's no guarantee that those instruments make it through the process. The problem, you know, for the current law, the reason why we have this epidemic around the country and around our state is because the youth are getting their hands on these products. And so with that, we have to make sure that if we're going to pass a law to raise the age to 21, we have to make sure enforcement is tight. We have to make sure fines and fees are tight, and we have to make sure that you know, all these issues are being addressed at the same time. A key tactic of the tobacco industry that they're using throughout the country, Altria and Juul, is just telling lawmakers to just simply change the age from 18 to 21. We know that they wrote these laws back in the day, and they know that, you know, if it's going to be something that's going to hurt their profits, why would they support it? And so, you know, again, we support Representative Hoffman's intent of the legislation, and we want to keep the youth from getting their hands on these products. And we want to be able to reduce that healthcare cost. I can't remember who stated it, but healthcare costs related to smoking in Louisiana is $1.89 billion. And, you know, we went through several special sessions looking at money, and, you know, smoking had a huge impact on the healthcare cost of our state. And as I stated in my opening, we have concerns, but we do support the intent of the bill. We would like to work together to continue to improve the bill as it makes its way through the process. And to answer your question, Vice Chairman Miller, on the preemption portion, the preemption in this specific code of legislation, as I understand it, is on the enforcement piece, is on the marketing piece and promotion of sales. It doesn't touch on, in the Clean Indoor Air Act, that's a separate law where it allows locals to go in and pass smoke-free ordinances. And with that, I will answer any questions if there are any.
Yes, I have Representative Chaney for questions.
Thank you, Mr. Vice Chair. You know, it's amazing to me that we have a bill of this magnitude moving the age from 18 to 21, and we have two very prominent organizations in this smoking debate sitting at the table. What this bill is going to do is it's going to be a starting point. 18 to 21. This is a starting point. There's follow-on legislation, you've already heard that, you've already alluded to it yourselves, about the enforcement and fine situation. Let's take what we can get. Let's don't try to do anything that's going to lessen this bill, the importance of this bill we have before us. Let's work on the enforcement and the fines going forward. So I would have hoped that your testimony, the thrust of your testimony this morning would have been more in favor of this. I understand what you're trying to say. It doesn't go far enough. I think most of us that are in favor of this bill would agree with that. But there is a starting point. That's where we are today. Thank you, Mr. Vice Chair.
There are no other questions. I do have one question. So if we pass this out of here today, is there anything that's going to stop a bill passed that's going to have $200-$300 fines on young 18-year-olds who are addicted to cigarette smoking?
So real quick, Claudia Roda's campaign for tobacco-free kids. I know I didn't testify, and I'm glad that you answered some of the questions on preemption. I know we didn't want to leave this committee hearing without actually clarifying the fact that we can continue to work on smoke-free policies. There is preemption written into your current statutes where we have where our concerns really lie. So for our organization, we do support the intent. We are very happy that the Louisiana legislature is having this debate among several other states who are also in similar discussions. We just want to make sure that the strongest law for this state of Louisiana is passed with the proper enforcement, particularly in certain communities, and allow those communities to enforce their laws in the best way that those communities need to pass the laws. So this law will not have youth penalties. Those were taken out in the amendments. They continue to have retail penalties within the law. We just feel like those needs to be a little stronger and allow the opportunity for local communities to address enforcements in their communities around these issues in the way that those communities need to address it. We had an opportunity to look at your SINAR report, so if you haven't had a chance to look those, I know those are available every year within the agency that oversees or compiles all that data. And what that data shows that there are particular regions in the state that have higher retail violation rates than the state. So your state compliance rate hovers around 11%. But in certain regions, they go up to 25, 26%. And so we feel that the biggest problem that's, and we are very happy with the improvements that were made with the amendments. And I feel like we're going in that direction. But not to allow local communities, particularly those communities that have a higher rate, almost double than what your state has, and not allow them to pass enforcement in their laws or in their communities because those communities look different is our biggest concern in the law. So I know and I hear we're getting in that direction, which is why we're here putting in white cards. We want to continue the dialogue. We want to be able to improve the law. Your rates and your prevalence rates with your adults and your youth rates are the highest in the entire nation. And you have the opportunity to pass some of the strongest laws that are going to make the largest impact around that. And so what we're saying is take that opportunity to pass strong laws. Don't pass something that's weak. Don't pass something that's going to favor an industry that is killing your youth, that are killing your adults in your state. So the problem that we have, and we hope to be able to have continued dialogue as this process goes, is let's take a look at your enforcement and make sure that the laws that you're passing in your state are actually going to have the impact and allow those local communities in your region that have the highest rates of violation rates. Can you imagine 1 in 4 or 1 in, well, I guess they're range 25 to 27. So 1 in 4 in some of your regions, in your communities, are selling and continue to violate your law. So let's take a look at that. And that is our major concern right now with the bill. We are happy with all the amendments. We are so happy to be part of this dialogue. And we just hope, and we want a red flag, that let's really take a look and make sure that your law is really being enforced in your communities.
So my question is, we can pass this today and raise the age to 21, but as of today, we have no idea what the fines and penalties are going to be if anyone is caught purchasing tobacco at the age of 19?
You won't have any. You took out the youth penalties. So there will be no penalties on 18, 19, or 20-year-olds.
So the two bills that's going to be moving forward in the process will not add any penalties for 19, 20-year-olds that purchase?
Not for those individuals that are 18, 19, 20. They are affecting your retailers, those who are selling the product, which we feel should be held accountable and following your laws and not selling to minors.
So the two bills that's in works has no penalties on the purchaser?
No, we would never.
So what are our concerns, Mr. Barber, on the fees and penalties that may occur with the individuals who are purchasing tobacco?
So
she's telling me there's none.
It's on the retailers that we feel they need to be stronger in your laws.
But you're telling me that the two bills that's coming, there are no penalties for the person who's purchasing it. Am I misunderstanding something, or?
So it was on this bill originally, but with the set of amendments that Representative Hoffman offered up at the beginning of the committee, he removed the youth penalties because our concerns were around profiling the youth and adding some targeting mechanisms in there.
And currently the other two bills does not address the youth penalties. There's no chance that those bills can add a youth penalty.
I guess you could.
Actually, it could be.
Well, look, my only concern, I support raising the age to 21. My only concern is we as a committee let this out of the committee, and then when the law goes into act, all of these 19-year-olds start getting tickets and fines and end up in jail. So that's not, I think, what this committee wants to do. So I just want to be assured before I vote that won't happen.
We agree with you, and it does not exist with the set of amendments that you just accepted, that you all accepted as a committee.
Okay, there's no further questions for you, I don't think. We have more red cards that would like to speak in opposition. Chad Rogers from Louisiana Vaping Association. Jeff Weber from Smoke Free Alternative Association. Victoria Wood, the Vaping Tiger.
Hello, Councilman. My name is Jeff Weber. I am the president of the Smoke Free Alternatives Trade Association, the chapter here in Louisiana, co-owner of the Vaping Tiger, New Orleans Cloud Alchemy, and Crescent City Clouds. The first thing I would like to say is this is not a child prevention bill. This is a bill that 100% is infringing on the rights of adults. An 18-year-old is not a child anymore, according to 99.9% of the laws. They can sign up for possibly life-crippling student loans that they will be paying off the rest of their life. They can be tried as an adult and be put into jail as an 18-year-old. They can go into the military and die for our country. We consider an 18-year-old an adult after they are past a certain point in their life. This is restricting adult access to make a choice in their life. Whether we agree with their choices or not is not for us to decide, but to preserve the liberties of the adult. Now, the issue with children 17 and under smoking and vaping is an issue that we have to address, and this bill does nothing to address that. Nationally, the FDA has come out and currently has a 18 or older. Some of the people that are for this bill has said that the FDA might change that to 21, and they also boasted about 14 states. Those states have noticed that there are less purchases in that state. But 18-year-olds are really, really proficient with the internet. It is completely legal for the other 37 states to sell to that child that, well, we're now considering a child, but an 18-year-old, you have 30 some odd states that it is 100% legal to sell online to that 18-year-old. So all we're doing is pushing the sale off to a different state rather than preventing the adult from buying the product in our state through a store that is actually responsible, that they can actually look someone in the eye and get advice. I heard mentioned a few times today Altria and Juul. I don't know much about the smoking side of it. I quit smoking with vaping. I was a 24-year smoker, 2 packs a day. Vaping saved my life, and that is the reason that I quit my job as a professor to open up a vape company. Literally, it has saved my life. I breathe better. My color has come back. I can smell. My doctor is shocked that my lungs have actually recovered from a 24-year smoking habit. When you go online to purchase these products, Juul has outrageous nicotine concentrates that they have 30-something and 50-something milligram per milliliter nicotine. If someone came into my store and looked me in the eyes and said, I smoke 2 packs a day for the last 30 years, I would most probably suggest them to go on to a 6 milligram per milliliter, where other companies and online, you can't actually talk to a human being face to face. When I have someone that's 19 years old come in and talk to me, they say, hey, I want to be cool like my friends. They're all doing this vaping thing. I want to try that also. I will actually tell them or suggest to them, yes, you can still vape. We don't have to put nicotine into it. Where Juul, most of your online products automatically default to a nicotine containing juice, where when you go to the local shop, you don't need to have nicotine in any of these products. With all of that aside, the bill that's being introduced right now, without having a grandfather date, without having exemptions to military use, and not distinguishing between healthier alternatives to a combustible product that we've known for decades, that it's not the nicotine in a cigarette that kills you, it's the tar in the cigarette and the 4,000 additional chemicals that will kill you. Allow the person face to face, the adult, to make the decision. If they want to vape, they can still hang out with their friends and have that experience without actually having any drug whatsoever. Where if you push this onto an online system, of course the online system is going to sell you an extraordinarily high degree. I could go on for another half an hour about objections, but we do have other people that need to talk, but I am happy to entertain any questions because I do have other things I would like to mention.
Well, thank you, Mr. Donahue. Seeing no questions, we would like now to go to Ms. Hutton, if you would, please.
Oh, sorry, Victoria Wood.
I'm sorry.
Good afternoon. My name is Victoria Wood. I am co-owner of the Vaping Tiger in Metairie, as well as Crescent City Clouds in New Orleans, and I am in opposition of this bill. Multitude of reasons, but the primary reasons are due to the fact that 18 is a legal adult. We are taking away the rights of legal adults to make their own decisions. A different point I'd like to make is in regards to some of the people saying that this is about the youth epidemic and the teen epidemic. If you walk into my store, every single one of my employees is going to card you. We do not sell to anyone under the age of 18. We are a responsible vendor, And we have no problems in kicking you out of our store if you're under the age. Also, someone else mentioned that by selling the e-liquids that are flavored fruits, candies, that it is child appealing. My 72-year-old mother ate a bag of gummy bears 2 days ago. You can't tell me that adults don't like fruits. You can't tell me adults don't like candy. That is actually what saved my life and got me off of cigarettes. I was a 10-year, 2-pack-a-day smoker. I have now been smoke-free and strictly on vapor products for the past 7 years. I stopped with a strawberry, peach, and cantaloupe flavor. I have not picked up a cigarette. Actually, whenever I walk into an area that someone has smoked, I get nauseated. It turns my stomach. I am proof that there are alternative nicotine products on the market that can help get people off of traditional combustible tobacco products. That is what our products do. And by taking those alternative nicotine products away from 18 to 21-year-olds, you're just ensuring that they're going to go somewhere else and get it, perhaps to a different state. You can go over to Mississippi and get products from them, cigarettes, vapor devices. Regardless, not only are you restricting the ability, the constitutional rights of an 18-year-old, you're also driving business, local business owner. You're taking my business and the tax dollars that go into the state, you're taking that away from me, and you're putting it into a different state versus online sales or just people going to Florida, going to Mississippi, going wherever to get it. So please reconsider the 18 to 21 bill. Thank you very much.
Hello, my name's Chad Rogers. I'm currently the secretary of the Louisiana Vaping Association. We're a trade association that represents a multitude of shops across Louisiana. I myself am also a shop owner. I own 3 shops across South Louisiana. I came here to speak in opposition, but I also want to make some points that would agree with how enforcement should be handled. But I do want to start off with a quote directly here from the former commissioner of the FDA, Scott Gottlieb, who just recently stepped down. And quote, "I believe if every currently addicted adult smoker switched completely to e-cigs, it would provide a tremendous public health gain. This can be found in the Health and Human Services report on the health consequences of smoking, a 50-year report of progress." And after this, too, I'm going to send y'all some links on some of the stuff I'm quoting because I think it's really important to back up what's coming into this mic with something that's concrete and inevitable, too. A lot of this transition to move the law of age of purchase from 18 to 21 has a lot to do with access. Directly from the Health and Human Services website statistics that the Tobacco-Free Kids has actually quoted is saying that nearly 9 out of every 10 cigarette smokers first try cigarette smoking by the age of 18, and 98% of them try smoking by the age of 26. The majority average age of people starting to smoking on that same website was 15.4. So the access has gone way below 18. I think that with common knowledge among smokers, you might find that the first cigarette that they've had was either that of a family or a relative, and it was easily accessible. And this is where I speak on behalf of the association to say that we oppose this bill until it can be redefined to exclude vapor products from this bill. And I'm going to give you a couple of reasons why right here. So not only is it restrictive to adults who can otherwise beat the military horse to death. They can also make medical decisions. They can take out loans. They can pay taxes. They can get married. If they commit a crime, they are tried as an adult, and they can even receive the death penalty. The Tobacco 21 law that's popping up all over the place, it defies the age of majority. And it also segregates a very specific demographic of our citizens and our citizens of the United States and Louisiana, removing their right to a freedom of choice and equality across the law. Vapor products are not tobacco products. And I'm going to tell you, as a vapor product user, I like my nicotine, just like I like my caffeine. Nicotine in itself has been proved to be as equally as addictive as caffeine. And I like the fact that I can attain my nicotine through vaping without combusting thousands of chemicals of byproduction that could shorten or end my life. And I like the fact that my life and my career is currently based around people living a healthier lifestyle. There's no doubt smoking's bad for you. Vaping's not good for you either. It's still something foreign that we're putting in our bodies, but it's a choice that we make as an adult. It's a choice that we make as an adult to drink. It's a choice that we make as an adult to do the things that we do. Now, and I say it's safer, the Royal College of Physicians, which is essentially the FDA equivalent of the United Kingdom, put out a report, Nicotine Without Smoke, Tobacco Harm Reduction, has concluded that vapor products are 95% safer than smoking. I'm glad to give y'all a link to that report. It's incredibly in-depth, and it goes to show you how much risk you can take off when you provide a safer alternative to people who smoke. Now, these laws, they prevent the access to smoke-free products, and it's also keeping 90% of the smokers who begin before the age of 18 tethered to cigarettes for an additional 3 years. It's causing unnecessary harm to their health. Now, it's going to send 18 to 20-year-olds who already have quit smoking via vaping potentially back to smoking, as that cigarettes are far easier to maintain. This law potentially has the potential to put some dent in one of my shops where I'm close to a university, where 25% of my business is college kids under the age of 21 who choose to lead a healthier lifestyle that I have helped quit smoking when they left their hometowns to come to New Orleans, to go to Tulane, to go to Xavier. They find my shop, and now they've got an outlet to quit smoking, to lead a healthier lifestyle. Vape shops have always been built on harm reduction. We ID people, we educate them, and we coach them. Our whole job is to help people remove the cigarette addiction and move on to a more adult alternative, and in many cases help them quit. You start off smoking, when you buy from a Marlboro Red, or you can't even say the language has changed, but when you go from a full flavored cigarette to a light cigarette, you only reduce the tar and you don't reduce the nicotine, but you're still getting an overwhelming amount of chemicals that could still cause cancer. So and we found that smokers are going to have a better chance when they're provided with balanced and accurate information about their tobacco harm reduction options. And I think it's really important that this technology, everyone knows that this technology exists to eradicate tobacco-related harm. And if we truly want to snuff out smoking, then we need to provide smokers with statistically effective, time-tested, scientifically validated solutions. And this cannot be achieved by enacting laws that prevent adult access to tobacco harm products and push more adults potentially towards smoking. I wanted to make a note, too, about enforcement. There are only 20 enforcement agents employed by the ACC. Only 20. And I'll give you a quick background. Roughly, there was a lot of law changes in the terms of craft beer. There's 7,000 alcohol permits, the attorney told me. But less than 1% of those alcohol permits were ruled around craft beer. So there was a lot of laws that had to change and move and shift around because they were spending over 80% of their resources diverted to 1% of their cause. And that's half of what they do is alcohol. They're not even touching on tobacco. So if we really want to increase enforcement, then we need to further fund our ACT. We need those agents acting out. The ACT works solely on reports generated through their system. 3 weeks ago, and this is an issue related to CBD, and I'm not going to get into that, but for an example, I use the anonymous report system.
I think we're going to need to go ahead and wrap it up if you don't mind, please.
I apologize. But I use that system to report my shops as selling to see if did that. 3 weeks later, I have not had an agent visit. So these systems, they're not following through. You can't enforce the people selling the products if you don't have people enforcing them. And if you're getting compliance checks on a regular on thousands of permits, you're not following through with the best opportunity you have to penalize the seller. So in conclusion, I do want to say this real quick, that it was a direct quote from Jeff Stevens. He's the director of the American Cancer Society. He said, "Youth access laws are amongst the least effective ways to prevent minors from getting a hold of tobacco products." And I think that'll be all.
I see no questions, but I do want to thank each one of you for your testimony. I think that, you've taken the time to come down. This is the people's house, and we allow that and encourage that. So we thank you for your testimony.
Thank you, sir.
Thank you. I think we have some other people who would like to come and speak. Ms. Hutton, you here? Mrs. Brittany Usan.
She had to leave. She couldn't wait.
Okay. And then also Mr. Donahue.
Yes, he also had to leave.
So it's up to you.
It's all me.
Thank you. Go ahead, please.
Thank you to the committee for allowing us to speak today. I appreciate it. My name is Heather Hutton. I am the president of the Louisiana Vaping Association. And before I get started, I do just want to clarify something very, very quickly. I am not here representing Juul. I have vape shops. I do not carry Juul. I do not promote Juul, and I do not. We are no way associated. I know that a lot of the other people that came up, it seems like a large focus of the issue here is the Juul products. So I do want to make sure that everybody here understands that your vape shops on the corner, and any Louisiana LAVA member, Louisiana Vaping Association member, does not carry Juul products in their vape shops. We decided collectively to take a proactive step because of the teen access, and we decided to remove those products from our stores. So I think that that's important that y'all do understand that as we are the businesses here in your state. We are the businesses that are going to be affected by any of these regulations that you put through. And I wanted y'all to understand that we are taking proactive steps to prevent that. But I'd like to thank the committee for providing us with the time to express to you, our elected officials, our concerns with HB 38. I am speaking to you today not only as a representative of LAVA, but also as a business owner and constituent, and also as a mother. I have two children who are in this age bracket, 17-year-old son and a 20-year-old son, both who would be affected, both of them who I think have the right to make a decision, as hard as it is. And as a mother, you can't always hover over your children, and you have to raise them and put them out into the world and hope that they make the correct decisions. Thankfully, both of my children have made the correct decisions. Neither one of them smoke or vape, and both of them, I've owned my business for 6 years, so they have grown up around vapor products and have been properly educated. I think that that's a big misconception, that we are looking at more of restricting and prohibiting teens from having this instead of educating them and putting a focus on educating them on the facts. But before y'all make any kind of regulations, I'd like for y'all to understand the difference between vaping and smoking. As Chad said earlier, the Royal College of Physicians has concluded that vaping is at least 95% safer than combustible cigarettes, while the FDA has also acknowledged it is the chemicals, not the nicotine, that causes cancer, lung disease, heart disease that kills hundreds of thousands of Americans each year. Either way you look at it, vapor products are safer, and to perceive them to the public as harmful as combustible cigarettes is just irresponsible. This perception will drive consumers back to combustible cigarettes. This is bad public policy, and it directly impacts our health care costs of smoking-related illnesses. In March 2016, and this is really, really important because this is directly on age restrictions with vapor products in this. Cornell Medical School found that e-cigarette age restrictions led to a 11.7% increase to teen combustible cigarette use. So when you put a bill like this through, it is very important that y'all understand that teens they're going to go back to cigarettes, combustible cigarettes, which are causing all of the problems, the health risk, and cause a tremendous amount of more problems than vapor products do. The restriction to vapor products to legal adults is not only a direct violation of rights, but it will have a detrimental effect on the health of these young adults looking for a safer alternative, while increasing teen combustible cigarette use. Regulations such as HB 38 is not an effective way to prevent youth access. Teens will always seek the forbidden fruit and find a way to get them. I have previously presented Representative Hoffman with legislation that would instead separate vapor products and hold minors accountable for having them in their possession. This would be a more effective way of deterring youth access without infringing on the rights of young adults. It's a really slippery slope when our representatives start taking our rights away as an adult. And it's a slope that I hope that Louisiana does not decide to go down. At 18 years old, you're considered an adult in every aspect of society. Legally, you commit a crime, you're charged as an adult. Our parents expect you to get a job, expect you to go to college. Our country expects you to fight for our country if you're called upon. You can enter into contracts, accumulate debt. You are an adult in every aspect of life, but you, our elected officials, are going to say that you're not adult enough to make a decision if you'd like a smoke or a vape. Well, I'm here to remind you the government does not get to make this decision for us. You are here to protect the rights of your constituents, and each adult 18 to 20 years old has that right to make that choice, and to restrict the access to a healthier option by including vapor in this does not make sense, and it's bad policy. The regulations also have an economic impact on the state's budget, and I would please urge the committee to please, before pushing this through, to take all of these unintended consequences into consideration, possibly put it up for a study to know before you're just pushing this through and infringing on people's rights and not knowing the unintended consequences that could come out of it. And that's all I'd like to ask for today. Thank you.
And thank you. I do believe that we have a light here. Let's see. Mr. Stagney, you have a comment, question?
Yes.
Did you fill out a card?
Yes, sir. Mike Donahue.
Okay, Mr. Mike. They said you weren't here, so go ahead, if you will,
sorry.
please.
I'm here. I'll keep this as brief as possible. My name is Mike Donahue. I represent ShopRite and Tobacco Plus convenience stores. We are a family-owned business, Louisiana-owned, Louisiana-operated. We employ about 775 people. All of our stores, 58 plus, are located in Louisiana. We consider ourselves to be a great corporate citizen. We like to do things the right way. One of the things that I want to point out to the committee is that about 10 or 11% of the acquisition of both tobacco and electronic cigarettes by youth has been reported and said earlier to occur through convenience stores. That means 89% is through social sources. I will tell you that we have spent hundreds of thousands of dollars on our point of sale systems to require all of our clerks to scan IDs before they sell any tobacco or alcohol product. If they don't have an ID, they don't get the product. So there are opportunities for improvement, but I think 10% is not too bad. I would say our success rate is more in the high 90s as far as not selling any products to underage teenagers. We don't sell, we don't condone, we don't employ people who sell to youth. The Alcohol and Tobacco Control Office does stings throughout the state. I'm sure you're aware of that. If not, they also do stings for the FDA. If we have an individual who flunks a sting in our company, they're working for somebody else the next day. We're serious about being good corporate citizens. We don't tolerate people who sell to youth, and we don't condone youth usage of tobacco or vaping products. As a matter of fact, from the smoking cessation viewpoint, we have carried in our stores for over 12 years smoking cessation products. And I will tell you from our experience, the first and most successful smoking cessation product that we have seen are electronic cigarettes. Currently, teenagers are obtaining these products in a large part through social sources. Those sources include brothers, sisters, cousins, parents, aunts, uncles, older friends, and we understand that they are very, very creative in the way that they acquire these products. We believe that raising the age from 18 to 21 will just encourage them to look for additional sources, whether it's a 21-year-old friend, an older brother or sister, certainly through the internet and social sources. If you can check the social media, whether it's Snapchat, all of these sources, you'll find people selling electronic cigarettes and vaping items that way. Also, it was mentioned earlier that we will encourage at least all the 18 to 20-year-olds and then younger to go to the eastern side of the state, catch I-10, drop into Mississippi, and buy everything you want, and come back and sell it to the underage kids. The net effect is that we're going to still have a problem with teenage use of electronic cigarettes and tobacco. If you looked at the fiscal note, nobody's mentioned the fiscal note yet. The fiscal note says that if this bill is passed, that the state will suffer an estimated revenue decrease of $5,923,075. The fiscal note on the bill is based on a calculation on information received from the Department of Revenue, which in turn based the loss of revenue from information they received from the Preventing Tobacco Addiction Foundation, also known as Tobacco 21, who estimates that purchases by persons under 21 account for approximately 2% of tobacco sales nationwide. This information is directly on the fiscal note. It was also stated earlier that and if you look on the Tobacco 21 website under the drop-down menu for Louisiana, they say specifically that an above-average rate of high school and adult smoking occurs in Louisiana. Therefore, the logical conclusion is 2% is probably lowball. So that fiscal note could actually double. Also, there's no note on the fiscal note on the effects of lost sales tax. So theoretically, if it doubles, it goes from 5.9 to 10.8. If you include the loss of sales tax revenues, you can include another 1.5 to 2 million on top of that. Okay, so we're looking at 12.8 in lost state revenues. Teenagers react and respond to peer pressure. Anybody who's had kids, teenagers, you know that. If they want to belong to a group, they better start vaping because it's cool to vape. Used to be cool to smoke. It's cool to vape now. If you don't want to get kicked out of that group, you better keep vaping. They don't know, and that was stated earlier, they don't know what they're vaping. They just know it's cool to do it, and I'm not smoking, so it must be okay. They don't know the amount of nicotine in what they're vaping. They just know this is cool, and I can blow a cloud with my buddies. We believe that the solution is education. There has to be a change in social attitudes to affect change in social behavior. The Tobacco 21 website also states that our state, quote, only spends 11.8% of the CDC recommended amount on tobacco prevention. Again, we do not condone the sale or the use of tobacco or vaping products to underage kids. But our question is, how can we increase funding toward educating teenagers about nicotine, which they don't know what they're doing, when this bill will reduce the state revenues? Therefore, we fail to see the benefit of this bill. Thank you for your time. Appreciate it.
Yes, ma'am.
Excuse me, I forgot to mention, nobody has mentioned anything about the employees of the vape shops. I have 5 employees right now that are between the ages of 19 and 20 that would lose their jobs because you can't work in a vape shop with this bill as it's written, if I understand correctly. So that's only in my one business. I have 13 employees, 5 of them are between these ages. I would have to fire 5 employees. I don't think anybody's even touched on that. And that's a serious impact to, you're talking about people who, this is their livelihood. This is how they take care of their families. I have 2 employees who just had brand new babies and are trying to get married that would no longer have a job. And I don't have anywhere else that I could put them. And I think that that's another unintended consequence that the committee also really needs to look at before making any kind of decision on this.
Thank you for your input. See no questions. Representative Stagney, I believe, has.
Thank you, Mr. Acting Chairman. I know the hour is long. I did want to bring or ask LDH to come to the table. We've heard some testimony on vaping as a cessation tool, and I'd like to ask some questions to LDH if that's possible. And I'll try to make it brief.
While they're coming, I'd like to recognize Mr. Bagley.
I'd like to ask if we can put a 3-minute time limit on discussion in each one of these. We've gone way too far in all this.
Representative Bagley has made a recommendation that we go to a 3-minute rule. Is there any objection? Without objection, so move. 3-minute rule is in order, so keep your comments appropriately. Back to you, Mr. Stagley.
Thank you, Mr. Acting Chairman. Can you give us some facts and figures on vaping, and is it used as a cessation tool?
Sure. So my name is Alex Bew. I'm the Assistant Secretary for the Office of Public Health in Louisiana Department of Health. So you'll hear that e-cigarettes are promoted as a smoking cessation tool. They are not an evidence-based smoking cessation tool. We have a lot of nicotine alternative medications and therapies that we have good evidence behind that we want our providers to give. E-cigarettes have not met that level of evidence need. One other point that I'll make is that unfortunately we don't see people transitioning off of e-cigarettes and cigarettes. What we see is a lot of overlap. So if we talk about adult smokers in the state, nearly 80% in our surveys use both e-cigarettes and cigarettes at the same time. So it may be that the situation changes where they're smoking versus where they're using e-cigarettes. So we hear the arguments that people are saying this is a way to get off of e-cigarettes, and that's not the case. The other thing that we're seeing in data is that with youth, they're 4 times more likely to start using smoked tobacco if they start with e-cigarettes. You heard about the high nicotine burden in e-cigarettes. The challenge is, as you heard earlier, this is the 3rd most addictive drug. And so starting on that is certainly going to be a gateway to potentially other tobacco use as well. So we see this as a great concern. We are strong supporters of Representative Hoffman's bill, especially with the amendments.
Thank you for your testimony. Mr. Acting Chairman, I know we're going to bring the author back up to close. I don't know if anybody made a motion to move this bill to the floor favorably, but I'd like to do that at the appropriate time.
Thank you, sir. See no further questions. Up to you, Chairman Hoffman, to close.
Let's see, I have 3 minutes to close, right?
I do have some cards prior to your closing that I'd like to read in.
Go ahead. I'm not going to take 3 minutes, but go ahead.
There's some cards in opposition, would not like to speak. Jessica Starnes, Donald Houston, Cody Gillian, Ryan Houston, John Lalou, Renee Amar, Josh Borrell, Jim Nickel, Chaz Colin, and Gina Goings, and Ty Brommel. I think that's the ones that are in opposition, would not like to speak. Back to you, Mr. Chair.
The people you heard from in favor of this bill are from the medical community. This is a simple but tremendously important concept. It'll reduce deaths, make better health, save money in the long run, lots of money in the billions of dollars, and make life better for many. It's not that complicated. It's a thing to do. Thank you.
Thank you. There was a motion by Representative Stagney that we would move this bill favorably. Is there any, with amendments, I'm sorry, is there any objection? Have one objection. Representative Bagley objects, so we'll take a vote. Those that are in favor of the bill will vote yes. Those that are in opposition will vote no. We got that? Yes vote is for the bill. No vote is not for the bill. Would you call a roll, please?
Representative Bagley? No. Representative McMahan? Yes. Representative Turner? Yes. Representative Moore? Yes. Representative Chaney? Yes. Representative Cox? No. Representative Jackson? Yes. Representative Johnson? Representative LaBalle? Representative Miller? Yes. Representative Pope?
Yes.
Yes. Representative Stagney? Yes. Representative Stokes? Representative Hoffman?
Yes.
Representative Stokes? We're voting on House Bill number 38 by Representative Hoffman. Yes. Representative Stokes is yes.
Thank you.
It's going to be 11 to 1. 11 to 1.
Thank you. Motion is 11-1 to move favorably to the full board.